Hi, it's Bob Pike. We're going to continue with this triad of change and looking at a very important and almost invisible aspect of the health question. I'm in the community of healthcare providers. Some of us are also self-care providers, people who help others learn how to do self-care. And some of us are also doing crisis care. And so it's all blended together. And however, there's a kind of an underlying belief, or we talked last night about how the triad of change can everything's interrelated. Perceptions are connected with how we behave. Our behaviors are directly related with what we have in our lives, the structure of our lives, our relationships, the things we do, all of those structures. And those structures prove what our perceptions are. Now that might sound too deep for this time of day, but you can listen again later. The issue with respect to perceptions I want to address in this short video is how our concept of health is attached to how we feel. When I encourage one of my patients, for example, to bring in their children and their spouse, they say, well, they feel great. They're healthy. And I say, well, how do you know that? And they usually always say, well, it's because they feel so great. So that's a belief that we have. And on the flip side of that belief, the equal and opposite would be, is it possible that you can feel great and really not be very healthy? Think of some examples in your own life. So if our perception is that how we feel is how we are, then our behavior is going to be, well, just kind of, what's the behavior? Wait until we have a symptom before we go to someone who does self-care to teach us, or someone who does health care, a dentist, a chiropractor for an adjustment, a massage therapist for soft tissue work, an acupuncturist for relief through treatment of acupuncture and needle therapy on the meridians, homeopathy, a way of balancing the physiology of the body using plants and the energies around that. These are all treatments. So, and when we're doing these behaviors, the structure of our life really doesn't change. The question is like, well, should I do this or that? This or that, but it's always to treat something that we have waited for it to happen, because the underlying belief in our healthcare approach is that how we feel is how we are. But we've just proven that's not true, because, well, one example, a friend of mine his wife had a friend who was 50-ish, overweight, and when she was having some shoulder pain, so she went into her a general practitioner, and the general practitioner says, look at you, you probably have a gallbladder issue. And there was testing done, and she was sent in for a gallbladder procedure and was found to be riddled with cancer, full of cancer. So how do we reconcile these two beliefs? How you are, how you feel? Or conversely, how you feel doesn't tell you very much at all about how you are. And so I'm going to suggest, as a chiropractor, because it's my profession, which is pretty much pioneering this concept, is that how you function is a much better metric. If you can measure how you function, then you're going to learn something about how the body's adapting, aren't you? So that would be a different behavior entirely, but it's based on changing a perception, and this perception has been reinforced for decades and decades and decades and decades and decades. And so I know this because I have this conversation with my patients, I give classes, and if I don't repeat it or do drip email marketing to remind people about this radical concept that function is a more dependable metric in terms of how we actually are than how we feel is, they will forget. And it will be replaced with, you guessed it, it will be replaced with the perception that has been habitually held and protected and defended. And so I'm going to suggest in this little video that you think about this and think about, well, how do we measure health? And so that is a good question. MDs measure it using chemical tests, don't they? They measure how the liver is functioning by measuring certain chemicals in the blood and looking at whether it's positive or negative. And so it is relevant to test function. However, the testing I do in my office, and a lot of my colleagues do, is we test the nervous system. Now, what makes the nervous system unique is it's the system, and this is part of a perceptual change. If you're going to, don't take my word for it. Ask Google what's the master control in the body, and you will find out that it is the brain, and the brain controls the heart, and the brain controls the liver. The kidneys don't control the lungs. So the unique thing about the brain is that it is a master system, and it communicates through the nervous system protected by the spine. Chiropractic is a way of measuring disturbances in the nervous system. So the new perception becomes you are how you function. Best thing to measure is the nervous system because it's the system that controls all of the other major organs. That's enough for today. Have a great evening. Thanks for paying attention and visiting the Pike Chiropractic Facebook page. Please become a subscriber to my email, not the email, the YouTube. It's Bob Pike. Looking forward to seeing you there. Thanks for visiting.